gentlemen, introduction of artificial intelligence has revolutionized every aspect of medical field. Integration of AI in pediatric dermatology has the potential to enhance healthcare delivery, education, training, research and innovation. To talk on the topic of AI in pediatric dermatology, we have a very young and dynamic dermatologist with a special interest in pediatric dermatology. She has been working as senior registrar at the Institute of Child Health, Children's Hospital, Lahore. She has been. And currently he is working as consultant as SR at Lahore Medical and Dental College.
Please welcome Dr.Anam Mahmood. She will throw some light on the topic of pediatric dermatology in the era of artificial intelligence.
आप सबसे एक क्वेश्चन, आप सब में से कितने लोग समझते हैं कि AI यानी आर्टिफिशियल इंटेलिजेंस फ्यूचर में हमारी दोस्त है या एनिमी? जिनका ख्याल है कि दोस्त है वो हाथ खड़ा करें। दोनों है? अच्छा, ये बिल्कुल यही मैं सुनना चाह रहा था। अच्छा, कितने लोग समझते हैं शरीके वाले? शरीके वाले ये मतलब डॉक्टर नबीस एक्सप्लेन शरीके वाले।
जिनकी ना दोस्ती अच्छी ना जिनकी दुश्मनी अच्छी।
But trust me, future and our best friend in future will be AI. So this topic is very important. तो आपके इसके जो जहन में जितने भी concepts हैं, I think कि इस topic से काफ़ी हद तक clear हो जाएंगे। और मेरा ख्याल है कि in future AI will be still our best friend and it will be one of the best friend. Dr. Anam.
Assalamu alaikum. I feel humbled and feel privileged to be part of this symposium today. Let's begin our talk about era of artificial intelligence in pediatric dermatology. Before continuing further, we should look at what is AI basically. It is one of the computer science disciplines that aims to simulate human cognitive functioning in terms of reasoning, learning, and decision making. History, the term of AI was first coined in the middle of 20th century, and later on its progression was very slow. And as far as dermatology is concerned, first research which was based on AI was done in 2018 and just recently, a few years back. Much of the work around the AI was incorporated in the health sector department during the COVID and the post-COVID era. So what is artificial intelligence based on? What is AI using? AI is using computer language models, and these models basically interpret our clinical notes. They make novel correlations and this make and analyze synthetic images. And we can say that they are simulating the human functioning. Much of the research which is done today is based on two modules. A stronger AI system and a weaker AI system. The stronger AI simulates with human level intelligence, whereas a weaker AI, which the research available up till today is around the weaker AI, in which only simpler tasks are performed by the computers. With the advent and with the progression, AI has been further modified in the form of machine learning and deep learning. These terminologies are important in terms of aspect. If we want to do research on artificial intelligence in any field, we have to use one of these modules, which can be a machine learning module. It can be linked with the human input. It could be a neural networks. It could be deep learning. Much of the research today is based around the deep learning module. Every research is based on this module nowadays. So what is the role of AI in pediatric dermatology? Basically, the dermatological diseases are currently the fourth most prevalent non-fatal diseases worldwide, and currently we are facing three major challenges. Number one, there is a large amount of patient data. There is variation in patient histories and genetic information. Number two, there is a serious shortage of pediatric dermatologists available, not only in our country, worldwide also. And dermatologists available are also not equally distributed throughout the remote and non-remote areas. And number 3 is, till date, still only 25% of skin malignancies are being detected, rest are going undiagnosed. As far as pediatric population is concerned, almost 30% of pediatric care visits are due to a dermatological problem. And a research conducted on school-aged children showed that almost 90% were suffering from skin disease problem at one point. The problem of shortage of board-certified pediatric dermatologists is not only in our current situation, but also nationwide. A research conducted in US showed that 82% of pediatricians report that their patient had significant difficulty in approaching to a pediatric dermatologist. So the beginning of pediatric AI as well as the dermatology AI is lagging far behind than other specialties worldwide. It was first started as in the form of teledermatology by the great legendary professor Dr. Haroon in the late 1980s and 1990s, where a dermatology center was set up in a Mia hospital, and it was linked with other hospitals across the whole Pakistan. Many problems were encountered at that time. Recently, 72 journals have been published till date as of 2023 in 406 papers, with the maximum number of papers published in Journal of Skin Research and Technology. What are the applications of AI? How AI can help us? AI can not only helpful in diagnostic and prognostic, but it is also imparting its role in article writing and in the research work being done in different fields. It is also aiding in educational tool for the healthcare professionals. It can form personalized treatment plans for certain patient for the efficient follow-up, and as an addition to telemedicine and as a support to pediatrician. Current trends. Current studies which are done on the pediatric population, one of them is done on infantile hemangioma. It used artificial neural networking, the module, and it showed that there was 91.7% diagnostic accuracy, and the study was based on patient images only. Another study was done to identify psoriatic versus non-psoriatic conditions. It used a machine learning module, and it analyzed the extent of erythema and scaling in psoriatic patients. Another study done recently in 2022, it was based on neural network module, and algorithm was designed for allergen IgE screening assay, and it also showed 97% accuracy. And the role of AI cannot be denied in terms of interpretation of histopathological slides. With its further modification, studies have been done to interpret both direct and indirect immunofluorescence to classify bullous dermatosis, and in other way it is bypassing the human workload and human error. Another study was done to assess the ulcer risk in chronic debilitating pediatric patients, such as child suffering from cerebral palsy or with the prolonged admission in HDU because of SGS stents. Certain remote devices are made which can analyze the body temperature and can assess that risk. Is it the risk for ulcer formation or not? And yet again, the role of AI in detection of skin malignancy was where the AI first started in dermatology, and its role cannot be denied in our patients suffering from genodermatosis. What are the current challenges we have to face with AI? Number one is with ethical constraints, the financial constraint, the cultural beliefs, the educational barriers. Telehealth can aid and can overcome some of these challenges. Rest are because of incorporation of these complex systems in our healthcare, because we lack limited compatible smartphone applications and we are unfamiliar with the modern technology. Then there are challenges of data collection because data varies from person to person because of certain parameters have to make standardized in terms of image angles, zoom, sharpness, lighting, exposure, color balance. And the most important of all is that we are facing challenge in application to skin color diversity, because till date only the data present represent 2% of the skin of color data. So we have to collect our local data and we have to formulate it. then there is a side effect or a worse outcome is the AI cannot replace human completely. It cannot pick up the atypical presentation. So whenever an atypical presentation will be put in its algorithm, it will suddenly, its sensitivity will drop to 0. These are the most common screening applications being used, but these are mostly paid.
पिक्चर ले रहे हैं, पिक्चर देख रहा हूँ.
And what is the future? The future is now the human and artificial intelligence hybrid modules. That is, AI algorithms are now being, their efficacy is being tested versus the clinicians, so that maybe in future we see artificial intelligence sitting in clinic in the form of an expert or maybe a tool to an expert. So the conclusion is AI is the future frontier in pediatric dermatology. And we have to revolutionize our pediatric population care with the fusion of teledermatology and artificial intelligence. We should establish different centers so that we can link them with the pediatric dermatologist available, and we have to build enough software to analyze our local data. So artificial intelligence is a tool, not a threat, and it won't replace you, but a human who can use AI can surely will. Thank you.